The turning point. The year 2013 marked a turning point, not just for Dr. Padhani, but for prostate cancer detection worldwide. That year, a landmark study called PROMISE was being designed in the UK. PROMISE stood for Prostate MRI Imaging Study, and it would become one of the most important clinical trials in urologic oncology. The study's goal? Simple but crucial. Directly compare multiparametric MRI against the standard transrectal ultrasound-guided biopsy in detecting clinically significant prostate cancer. Padhani wasn't the lead investigator. That was Professor Hashim Ahmed and his team at University College London. But Padhani's years of advocacy and research had created the foundation that made PROMISE possible. The trial enrolled 576 men with suspected prostate cancer. Each underwent 3 procedures: multiparametric MRI, standard 12-core biopsy, and a more extensive template prostate mapping biopsy that served as the reference standard. The results, published in The Lancet in 2017, were unequivocal. Multiparametric MRI detected 93% of clinically significant cancers, while standard biopsy detected only 48%. Let me repeat that. MRI detected 93%. Standard biopsy detected 48%. The study also showed that MRI could have avoided unnecessary biopsies in 27% of patients, men who had no clinically significant cancer, and could have been safely monitored instead of subjected to invasive procedures. This was vindication, not just for Padhani, but for every radiologist and urologist who had been advocating for imaging-based detection. But here's what makes this story truly remarkable. Padhani didn't stop at proving MRI worked. He became a leader in teaching how to do it right, building the framework. You see, there's a problem with revolutionary medical techniques. They're only as good as the people performing them. An MRI is, at its core, just raw data. The meaning only appears when someone trained knows how to read it. And in the early 2010s, most radiologists simply didn't have the specialized experience needed to interpret prostate MRI with that level of nuance. This is where Padhani's impact became truly global. He became a founding member of the European Society of Urogenital Radiology, ESUR, and helped develop something called PI-RADS, the Prostate Imaging Reporting and Data System. Think of PI-RADS as a universal language for prostate MRI. Before PI-RADS, different radiologists would describe MRI findings differently, making it nearly impossible to compare results across institutions. One radiologist might say, suspicious lesion. Another might say, probable cancer. And a third might say, PI-RADS, Category 4. Wait, what? Okay, that last one still sounds technical, but here's what matters. PI-RADS created a standardized 1 to 5 scoring system. A PI-RADS 1 or 2 means cancer is highly unlikely. A 3 is equivocal. A 4 or 5 means cancer is likely, and biopsy should be targeted to that specific area. Suddenly, a radiologist in London, Mumbai, Toronto, or Sydney could read a prostate MRI and communicate findings in exactly the same way. Padhani didn't just help develop this system. He traveled the world teaching it. He published extensively on how to optimize MRI protocols, how to avoid common interpretation errors, and how to integrate MRI into clinical decision-making. By 2015, Padhani had become one of the most cited researchers in prostate imaging, with over 300 publications and thousands of citations in medical literature. But the real impact wasn't in academic journals. It was in exam rooms around the world. Then came the study that changed everything. The evidence was overwhelming. MRI-guided detection was superior in every measurable way. But would healthcare systems actually adopt it? Would insurance companies pay for it? And most importantly, would it actually save lives, or just detect more cancers we shouldn't treat? The answer would surprise everyone, including Padhani himself. The revolution goes mainstream. In 2019, something unprecedented happened in British healthcare. The National Institute for Health and Care Excellence, NICE, the body that determines what treatments the NHS should fund, released new guidelines for prostate cancer diagnosis. Their recommendation: multiparametric MRI should be offered to all men before first biopsy. This wasn't a small pilot program. This was a national policy affecting millions of men. The NHS, one of the world's largest healthcare systems, was fundamentally changing how it detects prostate cancer based on the evidence that researchers like Padhani had spent years accumulating. The impact was immediate and measurable. A 2020 study published in the BMJ analyzed over 25,000 men in the UK who received pre-biopsy MRI under the new guidelines. The results? 28% of men avoided unnecessary biopsies entirely. Detection of clinically insignificant cancers dropped by 5%. Detection of clinically significant cancers increased. Think about what that means in human terms. Thousands of men spared from invasive procedures and their complications. Dangerous cancers found earlier and more accurately. Lives saved. Quality of life preserved. And the UK wasn't alone. The American Urological Association updated their guidelines. The European Association of Urology followed suit. By 2021, multiparametric MRI had become the standard of care in advanced healthcare systems worldwide. But here's what I find most remarkable about Padhani's contribution. He didn't just advocate for a technology. He built the infrastructure to make it work. Through his work at Mount Vernon Cancer Center and later at the Paul Strickland Scanner Center, Padhani helped establish training programs, quality standards, and best practices that made widespread adoption possible. He understood that changing medicine required more than publishing papers. It required teaching, standardizing, and persistently advocating even when faced with resistance. The bigger picture. Let's zoom out for a moment and understand what this story really means. Prostate cancer is the second most common cancer in men worldwide, with approximately 1.4 million new cases diagnosed each year. In the UK alone, it's the most common cancer in men, with over 52,000 new cases annually. For decades, we were diagnosing this disease with a method that was, frankly, not good enough. We were overtreating harmless cancers and missing dangerous ones. We were causing harm in the name of early detection. Dr. Anwar Padhani was one of the key figures who changed that, not through a single eureka moment, but through years of meticulous research, clinical application, education, and advocacy. And here's what's even more important. The principles Padhani championed for prostate cancer are now being applied to other cancers. Multiparametric MRI is being investigated for breast cancer, rectal cancer, bladder cancer. The idea of using advanced imaging to guide biopsies rather than performing them blindly is becoming standard across oncology. Padhani's work on diffusion-weighted imaging and dynamic contrast-enhanced MRI has applications far beyond prostate cancer. These techniques help doctors assess whether tumors are responding to treatment, whether cancer has spread, and whether surgery has successfully removed all malignant tissue. In 2022, Padhani was still actively publishing, still refining techniques, still pushing the field forward. His research has been cited over 30,000 times by other scientists, a testament to the foundational importance of his work. But perhaps his greatest legacy isn't in the citations, or the guidelines, or even the lives saved. It's in proving that one doctor, armed with evidence and unwavering conviction,